I've also heard this concept that menopause can cause bone loss. Is that something you can talk to us about as well?
Yeah, so estrogen is really important for bone health. And so, again, the ovaries produce estrogen that starts to drop off in menopause significantly. And so the bones can be affected by that. So there are certain things that can drive your risk factors, to have low peak bone mass, also osteoporosis, which is actually, kind of a dangerous bone condition that can lead to fractures and falls and affect the quality of your life. So yes, as your estrogen goes down, your bone health can certainly be affected. That's not to say that we don't treat sometimes with adding estrogen back in certain scenarios to try to reduce that risk of seeing those effects on the bones. But yes, we screen women that are menopausal and postmenopausal to screen just for their bone health to make sure that they're not in a category where they also need, a medication or lifestyle strategies to help prevent that bone mass that you may see, the loss. You can also do weight-bearing exercise, which is really important. And then an over-the-counter vitamin D and calcium supplement can also be helpful as non-prescription options for bone health.
I was just going to ask about calcium supplements. So is that something that women of a certain age should start making a part of their regular routine, and vitamin D as well?
Yeah, so those are worked into a lot of multivitamins as they are. If you're not already taking potentially a multivitamin or women's vitamin, prenatal vitamins, a lot of our reproductive age, patients take and women take, you could certainly consider taking both a calcium supplement and a vitamin D supplement. So there's no age recommendation for that as far as when you need to start. And a lot of that is worked in, to a multivitamin. But it's especially important to be mindful of as you start to be in that menopausal age to make sure that your bones are adequately supported.
So we're saying vitamins are key at all times.
Always. Yeah.
Always
Good
key.
lifestyle and vitamins always.